Do you have pain and discomfort in the abdomen very often? Whether your bowel habits are changing between constipation and diarrhea, whether these symptoms are associated with anxiety, depression, whether it is getting aggravated with stress. If yes is the answer, please do watch this video carefully. Namaste. Welcome to Ayur Yoga Health Tips. Irritable bowel syndrome or IBS is a common disorder seen by doctors nowadays. It is estimated that 1 in 10 persons have this disorder, and it is more common in women than men, especially in the young ages. What are the causes of irritable bowel syndrome? Irritable bowel syndrome happens when there is a dysregulation between the brain, the gut and the central nervous system, which causes the intestine to get irritated very fastly. And mostly it is believed that biopsychological factors play a major role, like stress, anxiety and depression is often associated with irritable bowel syndrome. Also, sometimes some physiological changes in the body happening due to previous pathological conditions like gastroenteritis can lead to irritable bowel syndrome. Also, we know there is a bacterial colony in our stomach. If this bacterial colony is affected due to continuous intake of some foodstuffs or antibiotics, that also can lead to IBS. Another major factor is the chemical food intolerance. Like we know, there are some carbohydrates in the food which we get intolerant, like the lactose in milk and dairy products, then fructose in some fruits like berries and vegetables like cabbage, and also sorbitol, which is commonly found in many of the diet drinks and diabetic drinks. IBS is also very common during the menstrual period in women due to hormonal changes. How can IBS be managed effectively? IBS is usually presented in two forms. One is the diarrhea predominant type and the other one is the constipation predominant type. If you are having diarrhea predominant type of IBS, you have to avoid fibrous foods and legumes. On the other hand, if you are having constipation predominant type of IBS, you have to take lot of fibers along with food and take lot of roughage. On the other hand, how to manage the pain and discomfort in the abdomen? Mainly, you have to avoid caffeine and aerated drinks, and also see if you are allergic or you are having hypersensitivity to some of the foodstuffs that you are taking. Traditional and complementary medicine is also offering a wide arena of therapies for IBS. For example, massage and manipulative therapies will help you to relax to the core. Mind-body medicine, especially the practice of yoga and meditation, should be encouraged. As we know, yoga and meditation are very effective to combat stress in a better manner. Again, herbal supplements can be taken, but only with the consent of your doctor or a qualified herbal medicine practitioner, especially anise, fennel, licorice. These things can be considered, ginger, and there are a wide arena of herbal supplements which are found to be effective for IBS. Then another factor that we have to take into consideration while managing IBS is the traditional treatments like Ayurveda, naturopathy and acupuncture. In Ayurveda, we have got several supplements and therapies which are effective for IBS. In acupuncture, we do needle specific parts, specific points which are highly effective for managing IBS. If you have IBS, do not fear, fight it out. We are here to help you.